All right, welcome. If you're hitting week 20 of your pregnancy, let me just say a huge congratulations. You've officially reached the halfway point. I mean, how incredible is that? This week is a massive milestone. We're talking big-time development, probably your most detailed scan yet, and maybe, just maybe, those first unforgettable little kicks. So you ready? Let's dive in.
So you're at the halfway point. You're probably wondering what's actually going on in there right now. What does your baby's little world even look like? Well, that's exactly what we're going to explore. We're going to take a peek inside the womb and see just what your baby's up to at this very moment.
Okay, first things first, let's talk about the star of the show, your baby. Seriously, the stuff that's happening inside that little fluid-filled world of theirs, it's just astounding.
Now, get ready for this, because it's pretty wild. That number you're seeing? 90%. Right now, your baby's body is made up of almost 90% water. I mean, think about that. It's because they're floating in all that amniotic fluid and their skin is still super thin. Now, that number will go down over time as their skin gets thicker and their kidneys start getting better at managing everything.
And this is what they're up to. They are not just passively floating around in there, no way. Their little hands and feet are getting super sensitive now, and they are constantly exploring their world. They're touching, they're feeling, they're even so flexible they can grab their toes and bring their feet right up to their mouth. Just imagine that.
Okay, here's something you can't see on an ultrasound, but it's absolutely happening. Right now, the foundation is being built for their future smile. I mean, for every single tooth they will ever have. The buds for their baby teeth, they're already fully formed. And now get this, deeper down in their jaw, the buds for their permanent adult teeth are starting to form right behind them. Mind-blowing, right?
All right, let's move on to what is probably the biggest event of the week, the anomaly scan. You know, that super detailed 20-week ultrasound? This is it. This is your first really, really good look at how all your baby's major organs and systems are coming along.
So what are they looking for? Well, the sonographer is basically on a mission. They are going through a whole checklist, meticulously looking at everything. We're talking brain development, making sure the spine is aligned, checking the 4 chambers of the heart, looking at the stomach, kidneys, bladder. They'll even count the vessels in the umbilical cord. And for most parents, this scan is just this huge sigh of relief, this wonderful reassurance that everything's on track.
So what are you actually going to see on the screen? Well, you'll see them taking measurements of your baby's head, the width, the circumference, all that. And check this out. They will literally count every single little vertebrae in the spine. It's amazing. And that's how they check for conditions like spina bifida.
They'll also zoom in on the heart to get a really clear view of its 4 chambers, making sure everything is formed correctly. And then they'll do things like measure the femur. That's the big bone in the upper leg, and that measurement helps them figure out your baby's overall size and just make sure they're growing just like they should be.
Okay, another really important thing they check is the location of the placenta. You know, that amazing organ that's been nourishing your baby. Sometimes it can be positioned a bit low in the uterus, and that's a condition called placenta previa. Basically, it means it might be kind of blocking the exit route, you know, the cervix.
And you can see here, there's a difference between minor previa, where it's just partially covering the opening, and major previa, where it's completely covering it. Now listen, this is the most important part. If they tell you this, do not panic. Seriously, in something like 95% of cases, as your uterus gets bigger and bigger, the placenta just moves up and out of the way all by itself. It's pretty amazing.
Okay, let's shift gears a bit. We've talked about all the clinical stuff, the scans and measurements, but now let's talk about something deeply, deeply personal. Because right around this time, a lot of you might experience one of the most magical moments of the entire pregnancy, feeling your baby move for the very first time.
Those first little movements have a name. It's called quickening. And honestly, it can feel so different for everybody. Some people say it feels like little bubbles popping or butterflies fluttering around. I've even heard it described as a tiny goldfish flipping over in your belly. But whatever it feels like to you, it's just, wow. It's this incredibly emotional moment. It's like the first real hello from your baby.
So of course, you're probably asking, okay, so when am I going to feel it, right? It's the big question. And while some people feel those first flutters as early as 15 or 16 weeks, for a lot of people, right around now, week 20 is the magic time.
But when you feel that first kick really depends on a few different things. For starters, the location of your placenta is a huge one. If your placenta is at the front of your uterus, that's called an anterior placenta, it basically acts like a big cushion between the baby and you, so it can make those early kicks much harder to feel.
Your own body weight can play a part, and even just where the baby happens to be hanging out that day. Oh, and if this is your first pregnancy, it's super common to feel movement a little later than someone who's already had a baby.
And that brings us to the last big topic for week 20. That anomaly scan we talked about, well, it usually comes with a pretty big question, one that a lot of parents-to-be face. Do you want to find out the sex of the baby? So, what's it going to be? Team find out or team surprise?
You know, there are really good arguments for both sides. If you find out, it can really help with bonding. You can start calling the baby he or she. Plus, it makes picking out a name and decorating the nursery way easier. On the other hand, a lot of people say that waiting for that big surprise in the delivery room is the best motivation ever. It keeps your eyes on the prize. And, you know, there's always that tiny chance the ultrasound could be wrong.
Which brings us to a really crucial piece of advice, and that is, sonographers are amazing, but they can and sometimes do get it wrong. It's never a 100% guarantee. So even if you do decide to find out, maybe, just maybe, hold off on painting the whole room blue or buying towels with a name embroidered on them. Just for a little while.
So there you have it, week 20. It's this incredible milestone where the whole idea of having a baby suddenly becomes so real. You've seen them in amazing detail, maybe you've even felt them move. You're halfway there, you're officially on the home stretch. So as you look ahead to the next 20 weeks, I'll leave you with this question. What part are you most excited for?